A very good evening and thank you for joining us on Nationwide Live on the network service of the NTA. I am Ifoma Ojinta. Now we begin with the latest from the NCDC, which states that 6 new cases of COVID-19 have been reported by the Nigeria Center for Disease Control. The agency, as at 9:30 p.m. 6th April, confirmed that there are 238 COVID-19 cases in Nigeria. The new cases, 2 in Kwara, 2 in Edo, 1 each in Rivers and FCT. The breakdown shows that 35 of the 238 cases have been discharged, while 5 fatalities have been recorded. In the meantime, the Presidential Task Force on COVID-19 has commended the Lagos State government for being proactive in containing the virus in the state. The Chairman, Presidential Task Force on COVID-19, Boss Mustafa, gave the commendation when he led other members of the team to inspect some of the isolation centers in the state. The team also inspected the Infectious Disease Hospital, Yaba, where all coronavirus cases in Lagos State are currently being treated. The facility at Luth, Idiaraba, as well as the newly set up center at the Bagada General Hospital. The Presidential Task Force was conducted around the centers by Governor Babajide Sanwo-Olu. Meanwhile, Nigeria's pharmaceutical industry's contribution needs to grow beyond the simple formulation of drugs to the production of active ingredients and engaging in original research and development. This was one of the major submissions of experts on NTA's Good Morning Nigeria, discussing the topic COVID-19, Nigeria's pharmaceutical response. Ikemini Williams reports.
As the world contends with the coronavirus pandemic, countries are being compelled by the huge demand for medical equipment and necessary drugs to look inwards to meet their urgent need for medical supplies. This is where Nigeria seems to be coming short, as the pharmaceutical industry has over the years remained stunted and has sometimes regressed in spite of the potential presented by the huge domestic market. Discussants in Good Morning Nigeria were of the view that the COVID-19 has exposed the country's vulnerability in this regard. They stressed the need for policies and engagement with industry to the development of a regional center for pharmaceutical manufacturing.
Halicin came into the market. And how did they come into the market? A private sector foundation partnered with MIT and put together a center for artificial intelligence and machine learning. And within a very short period, that particular center, which is a joint private sector and university collaboration, brought one of the most groundbreaking interventions in antibiotic history. We need to start seeing more of that in Nigeria.
All we need to do is to set an agenda. Let us start from producing the excipients. Let us look at the simple pharmaceutical products which we can produce, the active ingredients.
They canvassed the implementation of existing policies which can enhance the capacity of indigenous manufacturers to go into primary production of active pharmaceutical ingredients using locally sourced raw materials.
The NAFDAC at one time, by some other, not this current one, banned the production of chloroquine. The new one that had been administering is pharmaceutical. The resistance is developing on them too. So if we had the choice of having chloroquine restored for the treatment of malaria, there would be no shortage.
One of the major lessons from COVID-19, experts say, is that Nigeria must divert its dependency on foreign countries for medicine and look inwards through investments in research and development for the domestic pharmaceutical industry to grow. In Abuja, Ekemini Williams, NTA News.
Professor Abdulsalami Nasidi, a medical virologist, will be here in the course of the bulletin to throw more light on the recoveries of patients of coronavirus. Now, moving on, the lockdown on the nation's capital, Abuja, has entered its second week. Joshua Ojito monitored the level of compliance in the city centre.
It's day 8 of the lockdown in Abuja. The roads are empty, devoid of the usual traffic on a weekday like this, as residents remain indoors in compliance with the presidential directive to contain the spread of coronavirus. Security agents are at strategic junctions to ensure total compliance. The ever-busy Wuse market is under lock and key, as some of the traders who made efforts to access the market were turned back by security personnel. Except for those on essential duties who are seen on the road, there is high level of compliance to the lockdown. In Abuja, Joshua Ojito, NTA News.
Today is day 8 of the lockdown ordered by the federal government in 3 states. The Federal Capital Territory has been said to be having a high level of compliance. Here is Oyeyemi Ajayi, who went to the mechanic village to see the level of compliance. Over to you, Oyeyemi.
Today is day 8 of the sit-at-home enforcement by the federal government, and here I am at the Apple Mechanic Village, as people popularly call it. And here are some of the shops that you can see under lock and key. None of them is open at the moment, though some of the mechanics opening any shop, but some of them are just seated.
We're only here because we are nearby here. There's no other place we can go but to stay in this very place. At least you can see this tree here. Because of the heat around, we normally stay here.
Okay. My prayer is for this Corona-19 to come to pass, because it's affecting us, both business, both spiritually, everything.
Here is the one of the canteens inside the mechanic village, and as you can see, no one is here to eat, definitely due to the fact that they are already at their respective homes. These are food wraps ready for consumption, but as it is, no one is here to eat them. Now here with me is the owner of this place. His name is Mr. Timothy. Now normally, if you are to give a description of how this place used to be, okay, what will you say? And now, how it affects the business?
Sadly, by this time around, every person that comes to the market by now, at least maybe most of them, they want to eat food by now. At least here we'll be busy than now.
Like how many people would have gone?
By now, at least you get up to all the chairs. By now, I think when it's getting to 9 o'clock, 10 o'clock, the whole seat will be filled up. People eating, some going out.
Now here is the Tire Plaza, and normally there would have been beehive of activities here at this moment, at this time. But as you can see, no activity is going on here, still in compliance with the federal government. And one thing that all of them are talking about is that they can't wait to see the end of this coronavirus so that they can go back to their different activities. Back to you, studio.
Thank you, Oyeyemi. Now, the total lockdown order may be taking its tolls on many people within the Federal Capital Territory and other parts of the country. That, however, may not be said of Gwagwalada, a major entry port into the city centre of the FCT. Doyidia has an update.
It is one of the area councils of the Federal Capital Territory and a major stop for motorists coming into the city centre from 3 geopolitical zones and Kogi states. Despite the order by the federal government for a total lockdown of 14 days, many of the people here are not complying, a development that portends danger.
We got here and it's so surprising that business is at its ebb, as many of them seems not to understand the gravity of the situation.
I'm tired of sitting at home. I just say let me stroll around.
Well, are you not afraid of the dangers?
I am afraid, but with God all things are possible.
We don't have awareness on the issue of COVID-19 pandemic, because nobody from the government, from the part of the government and the private sector, there's not been much awareness about the COVID-19 to the people of Gwagwalada Area Council.
I didn't have food store. Unless I come out before I get my daily food. That is why I'm out.
But are you not afraid of contracting this deadly disease?
I'm afraid, but my children are crying with hunger in the house. I don't have any other things to give them.
That explains the number of activities taking place here, with heavy vehicular presence that betrays the present mood in the country.
We are going there often and often to close down their shops, and we are telling them to vacate there.
Sir, I'm from a hospital. I'm going home and I can't find my way home now. No, I don't have any paper to show. Do I have any need? Is there any need for me to show a paper? Yes.
Now, let's now link up with the Presidential Task Force on COVID-19 for the daily press briefing. In Lagos.
Can you hear me? Your Excellency, the Governor of Lagos State, members of the Presidential Task Force on COVID-19, distinguished gentlemen of the press, before I give my reflection of what I've seen in Lagos, I want to take this opportunity to give you a brief of what we have been doing and what the President through this committee has been doing. I am pleased to be in Lagos today, along with members of the Presidential Task Force on COVID-19, to interact with the Governor of Lagos State and his team, as well as inspect facilities put in place by the government for the control of COVID-19 pandemic. As you are all aware, the COVID-19 pandemic is the most significant public health emergency of international concern, having recorded over 1.3 million cases, causing over 75,000 deaths worldwide, as well as significant disruption to healthcare systems, particularly in low, middle, and high-income countries. In our case, the economy is also adversely affected. Since the inauguration of the PTF, the nation has been briefed on a daily basis in Abuja on the developments, especially at the domestic level. I therefore wish to seize the opportunity of this national briefing in Lagos to inform you that the national response, both at the federal and sub-national levels, is a unified one, carefully guided by national multi-sectoral COVID-19 pandemic response plan. We are also working in collaboration with the World Health Organization for guidance on issues of standardization and global policies. I wish to, at this point, assure all Nigerians of the unwavering commitment of His Excellency President Muhammadu Buhari to this war against COVID-19 and his readiness to mobilize the resources to achieve our national objectives. The strategy adopted by the PTF working in conjunction with the states include testing, detection, isolation, contact tracing, and management. This strategy has resulted in the following measures which you are all aware of. These are restricted travel from 15 high-burden countries worldwide. Second, closure of land, sea, and air entry points. Thirdly, restriction of movements in Lagos, Ogun, and the Federal Capital Territory, Abuja. And phase 2 have taken preemptive measures to restrict travel in several other states. And lastly, the introduction of social distancing and personal hygiene. With particular reference to restrictions, you are aware that Lagos and Abuja have become the high-burden areas in Nigeria, and drastic measures were required as part of the containment strategy to prevent community transmission. Let me, at this point, that it is not a desire of government to punish its citizens by restricting their movement. but rather out of abundance of caution. Out of abundance of caution, that difficult decision was taken to save lives by preventing spread. Reports have been received on the general level of satisfactory compliance in Lagos with the lockdown order, and we have similarly received reports of violations. In this case, I commend the Governor of Lagos State with his institutions at the instant action taken by the government by prosecuting and convicting notable violators, which shows that nobody is above the law. In recognition of the impact of the lockdown order on the poor, physically challenged, the elderly and vulnerable, Mr. President approved the release of 70,000 metric tons of grains from the specific grains reserve. Out of this, about 6,800 metric tons will be distributed in Lagos, Ogun, and the Federal Capital Territory, while the rest will be distributed to the 13 frontline states that have recorded cases of the COVID-19 disease. I assure you that the distribution of Lagos State shall commence shortly. Mr. President has similarly approved the payment of 2 months conditional cash transfer to 2.6 million poor and vulnerable already registered in the Social Safety Net Program. On behalf of Mr. President, I wish to commend the Governor of Lagos State, the people and government of Lagos State in controlling the pandemic and for putting in place isolation centers, ICU facilities, as well as establishing a wide network of contact tracing. The Commissioner for Health in Lagos State has also been serving as the chair of the committee of experts set up by the federal government to evaluate and accredit private medical facilities or other centers for the management of COVID-19 cases. In appreciation of all the efforts of Lagos State and the good people of the state, the burden that is carried, Mr. President approved the sum of 10 billion naira as support for fighting the virus. The federal government, in addition to the donation approved, allocated Lagos the lion's share of the PPE, face masks, face shields, and overall gowns donated by to Nigeria by the Chinese philanthropist, Mr. Jack Ma. A few days ago, my office authorized the deployment on loan of 15 Hillock vehicles from INEC to Lagos State to support contact tracing. The cumulative effort for the control of COVID-19 in Nigeria has attracted the commendation from the United Nations Secretary General, which assures us that we are walking in the right path. The United Nations Family in Nigeria has similarly launched the COVID-19 One Basket Fund, which was designed to serve as one COVID-19 financing and investment platform for mobilization of resources. Having stated the foregoing, I wish to emphasize that the nation is at war with an unseen but very potent enemy. To successfully prosecute this war, we must own it. We must participate in it. We must create awareness. We must obey rules and regulations. We must stay at home when ordered, and we must not conceal any information from the medical or disease control authorities. One person who is infected in a community can endanger the entire community regardless of its size and status or position of the people living there. Coronavirus is real and is dangerous. Let me appeal to Lagosians, indeed to all Nigerians, to play our roles in defeating this pandemic. To win the war, we must abide by instructions to stay at home, maintain social distancing, personal hygiene, and report all suspected cases to to the designated health authority. Before I end my remarks, let me, at this juncture, on behalf of the President of the Federal Republic of Nigeria, President Muhammadu Buhari, and members of the Presidential Task Force, truly and sincerely commend the Governor and the people of Lagos State for a remarkable, resilient, and resourceful fight against the coronavirus. Your Excellency, you have done very well. We have looked at the facilities that you have put on ground. We are quite impressed, and we are completely convinced that if we can deal with the Lagos situation, 70% of this pandemic in Nigeria have been effectively dealt with. So I want to commend you, and I want to thank you for your commitment and your determination and the resolute show of leadership that you have demonstrated. I believe strongly that going forward, the things that we have discussed this afternoon, the resolutions that we have made, the suggestions that have been put in place, if implemented, Nigeria would be one country that would show to the world that with collective resolve of its people and its government and the resources and the cooperation of the international community would overcome this crisis. But let me leave you with this parting remark. The COVID-19 has not only come to ravage our health, it is also come to ravage our wealth. As a people with the Nigerian spirit, our determination as a people, I am very confident we shall overcome by the grace of God. Thank you, ladies and gentlemen.
Thank you very much. Gentlemen of the press, we will now listen to the incident commander, COVID-19 Lagos, not in person of Mr. Governor, Mr. Babajide Olushola Sanwo-Olu, who will respond to what the federal government has just said via the secretary to the government of the federation.
Thank you very much, gentlemen of the press. The chairman of the Presidential Task Force on COVID-19 and also the secretary to the government of the Federation, Mr. Boss Mustafa, thank you very much for coming. Members of the Federal Executive Council, the Honorable Commissioner for Health, the Honorable Minister for Health, Dr. Osage Ehadire, the Honorable Minister for Interior, Dr. Rauf Aregbesola, the Honorable Minister of Information, Alhaji Lai Mohammed, the Honorable Minister of Environment, Dr. Mohammed Mahmood, the National Coordinator for the Presidential Task Force, Dr. Aliyu Sani, the DG NCDC, a man that we always see his face every day and night, Dr. Chikwe Kwezo, the Director Hospital Services, Dr. Adebimpe Adebiyi, Director Public Health, Dr. Umo Eniabong, the World Health Representative, Dr. Faisal, they didn't put your name, I recognize you. Other international partners here present, my colleagues in the Lagos State Cabinet, members of the State Executive Council, distinguished ladies and gentlemen of the press. Thank you very much for your patience. It's been a long day for all of us. We started this journey, I think, around 9:30 this morning, and I'm sure you know the day is fast spent. We're indeed happy. First, with Mr. President, Commander-in-Chief of the Armed Forces, President Muhammad Buhari, for setting up this high-powered Presidential Task Force on COVID-19. I have expressed the appreciation of Lagosians privately, through the chairman of the PTF, but I need to also express it publicly that on behalf of the government and the people of Lagos State, we cannot thank our president enough. We want to thank you for the leadership. We want to thank you for all of the things you've done behind the scene for us. And we can also see it from the level of responsibility and the level of commitment as been shown by the committee. It's no news that every day we get a national daily briefing from them. And we're indeed, it's nothing that we're happy about, but we're excited, that they consider Lagos an epic center. That's why they've come down for themselves to see where we are, what we're doing, the advice they need to give us, the corrections we need to take, and the collaborative effort that needs to happen between our government, all of the federal agencies, and the federal government of Nigeria. I'm sure we all know what are the responsibility of the PTF. It's a mandate to take necessary measures at ensuring that we bring this pandemic under control as quickly as possible. It's also a high-powered political, multi-sectorial coordination mechanism which brings about inter-ministerial agency and intra-ministerial and individual agencies of the federal government together, working collaboratively to ensure that there is a seamless engagement. They're not looking for somebody, the person is not here or is not around. All of them that needs to work together are what Mr. President has put together, and I think we need to thank him, for that. It's also a high-level coordination of all of our various United Nations agency, and so you can see WHO, you can see African Union, you can see UNICEF also working with them to ensure that we bring this to bear very quickly. It's also used as an organ to gather information, intelligence gathering, not just for COVID-19 alone, but also to be able to position our country for an event of future occurrences like this, so that they will have foolproof data that they can work with nationally. And I imagine that these are not very easy tasks that has been given to them, but I imagine they're doing it, and they're doing it very, very well. They're also used to facilitate economic national interest, which will mitigate the economic impact of the pandemic. The chairman of the PTF had explained to us that they had to take hard decisions, tough decisions, the lockdown of Lagos, Ogun, and Abuja, and he had said to us that it's not what they want to do, but for us to bring this pandemic to an immediate resolution, or to halt it, right? They needed to do what they're doing, and we're beginning to see the results of all of those initiatives and those difficult decisions that they need to take. And of course, we know that part of the assignment also is to form collaborative, effort amongst the various states. And so that's why they're here today, to see for themselves and assess not just the level of preparedness or readiness of Lagos, but really just to be able to see what are the things that they can continue to support us with. And they've gone round.
Done collaboratively, it's done at the national level, which they have the responsibility to also see, and they can report to Mr. President, and they can report to Mr. President,
and they can report to Mr. President temptuously and as regular as possible and as frequent as is necessary. And so I want to thank them again. We've gone round. They've been to a few of our facilities today, and we've also explained to them our other levels of preparedness. And we're indeed grateful that they are happy with where we are now, but we still can do more, given where we are with the general pandemic. So, SGF, thank you very much. Honorable Minister, thank you for finding out time. Various heads of agency, the coordinator of the committee, thank you very much. Thank you, our international agencies, thank you. Gentlemen of the press, I think I'm done with my own time. I think we'll just get a few other comments and we'll be open for questions. Thank you.
Thank you very much. Thank you very much, Mr. Governor. Permit me, Mr. Governor, to...
I think since the SGF has spoken, if there are just questions or clarification from gentlemen of the press, we'll take a couple, because they still need to catch a flight back to Abuja, and I'm sure you know they do daily reportage.
So, Mr. Governor, we're just going to have 3 questions,
okay,
because the guests need to
yes,
go back to Abuja.
Thank you.
Okay, thank you, sir. Hello.
You just say who the question is for.
Okay. Good evening, sir. My name is Ade Doja. Salam Adeni. I work with TVC News. Okay. Okay, my first question goes to the Minister for Health. Sir, I would like you to tell us that we know that the U.S. state of New York has just approved protocols for antibodies testing as a way of finding a fast antidote for COVID-19. We would like to know, beyond clinical trials for chloroquine, what other options you are exploring in Nigeria? And the governor of Lagos State, sir, we heard yesterday by the Commissioner for Health, Professor Akin Abayomi, that with the stay-at-home order, the curve of the rise of COVID-19 is flattening already. Now that people are on the streets, people are actually flouting the law, the stay-at-home law now, at least about 3 days ago, and we've not been seeing military on the roads as well. We would like to know if you are going to embark on the street enforcement over this. Thank you, sir.
Good evening, sirs. I am Mary Alale Yusuf from Channels Television. I'd like to know, after you have been around Lagos, this is to the minister, the other states, are they as prepared as Lagos to handle their COVID-19 cases right now? And then to the governor, you spoke about the team here, seeing your level of preparedness in the isolation centers, and then you spoke about other levels of preparedness. I want to know what those other levels are. Thank you.
Good afternoon, Your Excellencies. My name is Tokumbo Yetunji. I report for Arise TV News. I would like to know how much of attention we are paying to getting a possible locally cure for COVID-19. Then secondly, are we looking at any specific time when the lockdown in Lagos, Abuja, and Ogun will end, or we are looking at an extension? First one for the minister, and I think the second one for the SGF.
Thank you very much. Those are the 3 questions for now, sir.
Your Excellency, the Governor, Secretary of the Government, Honorable Ministers and Commissioners here present. The coronavirus, as you know, is described as a novel virus. A novel virus means that it's new, and the medicines that might work against it are not yet very clear. So different trials are going on in various places. People are trying all sorts of methods, and part of what you said just now is being tried, the use of convalescent plasma, which is taken from people who have had the coronavirus, they have been treated successfully. So you can take their plasma and see if you can use it for other people who are seriously ill. These are still trials that are still being reviewed and will be confirmed as time goes on. The same goes for chloroquine. Chloroquine has been found in some tests to work outside the body, what you call in vitro testing. But if you take it inside, if you swallow it and take it, whether it really works the same way as it works outside in a test tube, if it works in the test tube as well as it does outside, it's not yet very clear. Most of the countries in this world depend on the declaration from the World Health Organization, because the World Health Organization collates all this research and studies them and then makes the recommendation for countries to take. We also look at the World Health Organization, and we are joining in some of the studies that World Health Organization is organizing here in Lagos. The Honorable Commissioner of Health is doing all he can to participate in the trials, clinical trials for convalescent plasma and chloroquine, hydroxychloroquine, and the azithromycin that is being used in France. So the other question is whether the other states are well prepared. Well, they're as prepared as can be, but Lagos State, of course, a front runner. You know that more than 50% of all the cases of coronavirus in the country are here in Lagos. And quite clearly, because Lagos is an international airport and a country where we have the most travelers coming into the country are coming through Lagos, and this is an imported pathogen. It's not an indigenous pathogen. So the proportion for those ports of entry is relatively high. Abuja has the second highest, also because of travel, and importation from other areas can also increase your percentage. But the Lagos State has the additional advantage that they did very well in 2014 when they were handling the Ebola case. So there's a lot of institutional memory which is left over, which is helping a lot. And I have told the Commissioner that as other states begin to develop their public health response and protocols, they will come here to come and do some sort of study, maybe 1 or 2 weeks of hands-on to learn the tricks that Lagos has. So Lagos is very well prepared. Other states are trying. They have only few cases outside, so there's no comparison with what is here in Lagos. As to local cure, again, the question is how many how much do we know about this virus in order to find a cure? We look into every assertion. Some people say they have the herbs, and some people say they have the concoction. But for those who are serious, well, we have a department in the Ministry of Health, which is Department of Traditional, Complementary, and Alternative Medicine, which will look into your claims. We do not throw away any suggestion, but the efficacy and effectiveness of the medicine has to be proven before you are going to recommend it to people to take. So those traditional methods of cure are subject to study. I think that's all for the health sector.
Thank you very much. So there are questions for the Secretary to the Government of the Federation. Sir, there's a microphone, but it's going to be placed on the mic holder there, sir.
I think there was only one question for me.
Thank you very much.
I think there was only one question for me as to whether the lockdown will be extended. Basically, this is part of the consultation. We are looking at the objectives that were set when the lockdown or the quarantine declaration was signed by the President and subsequently by several other states. Before the end of the week, we'll do an evaluation, and part of the trip here was to do an evaluation to see how the objectives that were set are being met. And at the end of that exercise, we would have the responsibility of reporting to Mr. President, because Mr. President in his declaration did state that it was on the advice of the Minister of Health and the health experts that informed his decision to sign the Quarantine Declaration 2020. At the end of our evaluation, a certain set of recommendations and advice will go to Mr. President. And at that point, he and he alone will take the decision as to when the lockdown would either be extended or it will stop at the expiration of 14 days. Because in his address to the nation, he did say 14 days in the first instance, So it's open. It is based on what has happened within these 14 days. And the objectives that have been set, have they been met? Have we achieved success in the direction that we wanted to go? If that has been achieved, he will look at all the information available to him as the President of the Federal Republic of Nigeria, and I can assure you that he will take a decision that is in the best interest of the people of Nigeria. Thank you.
Thank you very much, Mr. Governor.
It's okay. Thank you very much. I think there's also one question for me regarding what are the other facilities or what are the other things we're doing. Okay, so there's several other levels of things we're doing outside of the scene isolation centers. So we have other facilities that we also reserved in the event that we need to trigger the usage of those facilities. An example is, so when we have people coming from the land border, right, and there was a request about yesterday about some people coming from the land border, and we needed to activate a facility at Badagry. So we have 2 facilities at Badagry, right? So when that happens, those facilities will go live, right? So we also have facilities in Ekpe, we have at Alimo Shore, we have in Lekki, we have in other places that are just waiting in the event that we need to activate and clear those facilities, especially for quarantine. If we need to just hold people for 14 days, we don't know their status, or just, we're not sure if it will manifest or not. So just to hold you down and see how you evolve, because it's not every case that you need to take to a red zone in the isolation center. You need to have what we call like a holding bay, and so those are the kind of facilities that we've also made available for them. Thank you very much.
Thank you very much, Mr. Governor. Sir, may I crave your indulgence to take one more question?
What's the question?
Okay, sir.
Omolara Omosoya is my name. I work for Radio Nigeria. Sir, my question is going to be directed to the SGM.
Oh, it's to me?
Yes, sir. In his nationwide broadcast, President Muhammadu Buhari promised to send relief materials to residents of Lagos, the states that are locked down. Already, the Lagos state government has distributed food stimulus to a category of people. So when is it going to get to the turn of Lagos residents, particularly those that are on the lowest rung of the economic ladder?
My brother, the governor of Lagos, is part of the federal government. So he's an extension of the president. And what he did is commendable, that he took that step to ensure that, because the primary responsibility for the welfare of the people is for those that are in government. By extension, the president and the governor of Lagos State. And he's demonstrated that by what he has done. In my address, I did mention the fact that he has already directed that 70,000 tons of what we have kept in our strategic grain reserve be released for the particular purpose of addressing as a palliative to the vulnerable, the poor of the poorest in our communities. And about 6,800 metric tons is dedicated to Lagos, Ogun, and the Federal Capital Territory. Yesterday, the Minister for Humanitarian Affairs, Disaster Management, and Social Development was in Mina to take over portions of the grain from the strategic silos that we have across the country. The one in Mina has some certain consignments. She was there yesterday to symbolically take it over. They are in the processes of bagging and rebagging. Those processes, like I said in my address this afternoon, that of Lagos, they will soon start delivering to Lagos for distribution to people who are deserving of these palliatives. It's not everybody that needs grains, but for those people that are deserving of these palliatives, I believe that very, very soon, probably within the next couple of days, Lagos State would have its share. Thank you.
Thank you very much. Thank you very much, sir. That will be the end of this session. And we want to thank our guests from the Federal Capital Territory, the State of Power in Abuja. Mr. Governor, that's the end of the briefing. Thank you.
Thank you. Thank you, ladies and gentlemen. Thank you.
briefing by the Presidential Task Force on COVID-19, briefing the press on latest efforts at curbing the spread of the virus in Nigeria. And the briefing was after an inspection of some facilities in Lagos. Now, moving on, President Muhammadu Buhari has sent a message of sympathy and solidarity to the British Prime Minister Boris Johnson as he wishes him a quick recovery and restoration to full health as he battles COVID-19. A statement by the Senior Special Assistant to the President on Media and Publicity, Garba Shehu, President Buhari praised the British leader. President Buhari praised for the British leader as he battles COVID-19 personally and with the British people as their country battles devastating effects of the pandemic. President Buhari praised that the Prime Minister will soon be well enough to resume his great leadership of his country at this most trying time in global history. We now join Dotun in Lagos for more Nationwide. It's over to you, Dotun.
Thank you, Fama. To curb the spread of coronavirus, Nigerians in Diaspora Commission has presented personal protective equipment worth about 1.25 million naira, a contribution from Nigerians to the Lagos State government. Amaka O reports that the contributions came from Nigerians living in diaspora.
Galvanizing efforts of over 30 million Nigerians across the globe towards the development of the country remains the primary objective of Nigerians in Diaspora Commission. This time around, the presentation is the first batch of items, mainly hand sanitizers provided by Nigerians abroad, particularly students in Wuhan, China, to aid frontline health workers and the vulnerable in Nigeria.
It comes as a commission to set up for coordinating diaspora activities. Went on its own to find a way of organizing our people to support us and support government in this initiative.
However, to getting the materials for testing, we have to call on the diaspora again worldwide to contribute into doing this.
According to the Nigerians in Diaspora Commission, about 1,006 Nigerians have indicated interest to return home as they continue to collate more names as a result of the coronavirus pandemic affecting countries of the world. In a related development, the Lagos State government says it has disbursed stimulus package to more than 100,000 households in the state, debunking rumors that voter cards were required for the collection of these palliative food parks.
In an emergency, you don't use card, you don't use anything. When you look at 100,000 households, we are talking of the father, the mother, and 4 children. That's 6 people in a household times 100,000. And our target is 200,000 households. That is, we are looking at 1.2 million people.
The palliative measure is a continuous process all through the period of the lockdown in the state. In Lagos, Amaka O, NTA News.
Healthcare services around the world are becoming overwhelmed by the coronavirus pandemic. As a way of ensuring that the country scales through the hurdles unscarred, corporate organizations are rendering assistance in the area of medical equipment to ensure that Lagos State and Nigeria as a whole are safe. The Nigerian Maritime Administration and Safety Agency has joined the vanguard by donating intervention facilities. Michael Olaleye reports.
Lagos, the city that never sleeps, now devoid of its usual trademark, traffic. That is the magnitude of the coronavirus, which the total lockdown is effectively containing. Beyond these measures, agencies and organizations are intensifying contributions towards keeping the unseen enemy at bay. This donation of 2 fast intervention vessels is to fast-track mobility and treatment of residents of Lagos living at coastal community, since no vessel can go to the anchorage.
This will surely go a long way, and it will form part of our coordinated effort to actually fight and win this pandemic.
Mobility tends to be the priority, as buses and ambulances are part of the facilities donated to speed up the fight against COVID-19. Aside keeping social distance and observing NCDC regulatory guidelines, use of disinfectants is gaining momentum as one of the means of containing the virus, hence the donation of this truck for fumigation.
Whenever there is need, we will now go for additional donations and contributions. We are all outside, to ensure that we are part of the strategy to bring these things down.
Other equipment given to the Lagos State government include 3 ventilators, 6 packs of oxygen concentrators, 32 packs of personal protective equipment, rapid test kits, and 150 packs of hand sanitizers. The agency also gave a cash donation of 20 million naira. In Lagos, Michael Olale, NTA News.
And that's it from here. Nationwide continues after this break. Don't go away.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
On Tuesday Live this week, we continue the discussion on assessing national response on COVID-19. What are the proactive measures being taken by the government? How effective are the palliatives in the containment of the coronavirus pandemic? NTA Tuesday Live at 10:30 p.m. Incisive and informative. Don't miss it.
The coronavirus, also known as COVID-19, has been declared by the World Health Organization as a global pandemic. While clinical trials are ongoing for a vaccine and a possible cure, there is no known treatment for the coronavirus. Nigeria has recorded some of these cases, and people are advised to take these preventive measures to keep themselves safe and contain the further spread of the virus. Wash your hands frequently with soap and water, or use hand sanitizers all the time. Maintain social distancing. Avoid touching your eyes, nose, and mouth. Practice respiratory hygiene. If you have fever, cough, and difficulty breathing, seek medical care early. Do not panic. Stop the spread of unconfirmed news. Follow the official government news outlets and report all cases immediately. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Shegun. How far say tomorrow still dey on?
What's your tomorrow?
Community meeting now.
You know they hear Abi?
Na beggy. See, if we meet for my house, inside parlor, then go know.
This COVID-19 is not a child's play.
If you want to elect a new secretary, we fit
do one for WhatsApp, or for Skype, or even on Zoom. Or we just wait.
I will not negotiate
this social distancing. It is non-negotiable.
Not every infected person shows symptoms, but every infected person is contagious. Avoid large gatherings and self-isolate if you think you might have come in contact with a carrier. Your safety and the safety of others is in your hands.
This message is from the Akin Fate Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
Thanks for staying tuned. There is a remarkable reduction in the normal operations of courts in line with the efforts to stem the spread of COVID-19. However, judiciary correspondent Vera Chemuba, who visited some courts in the Federal Capital Territory, reports that there was remarkable compliance with COVID-19 regulation, resulting in giving preference to urgent matters which were heard. She also reports that the Chief Justice of Nigeria, Ibrahim Tanko Muhammad, has extended the suspension of court sittings till further notice in view of lockdown measures put in place by the federal and some state governments to curb the spread of COVID-19.
The Chief Justice of Nigeria, Ibrahim Tanko Muhammad, has suspended court sittings in Nigeria except in matters that are urgent and time-bound. This is in a bid to curtail the spread of the deadly coronavirus, which is currently ravaging the world. In normal times, this courtroom would have been filled to capacity with journalists, lawyers, and litigants, but today it is empty. The court operations at this critical time are in line with COVID-19 regulation issued by President Muhammad Buhari. Regulation 7 provides the courts with some level of exception on court operations. A visit to some courts in the FCT indicates a remarkable level of compliance and awareness with measures put in place to safeguard, balance the health and safety of court personnel and litigants. Though the Federal High Court Maitama Abuja is scheduled to sit Tuesday 7th of April, the Court of Appeal Abuja Division has its cases spread across the various courtrooms, including the ceremonial court, in observance of social distancing.
Like the matter I appeared today, I sat alone in front. My colleagues on the other side sat alone in front. As you can see, you enter here, you will see the water, the sanitizers, and lawyers are observing it.
The experience here this morning is that the court is not congested. Social distancing has been maintained.
The premises of the Court of Appeal today shows compliance with the directives given.
At the Supreme Court, the courtrooms were under lock and key as no matter was slated for hearing on Monday, but measures to curtail the spread of coronavirus were reflected. In an earlier directive, the Chief Justice of Nigeria also ordered temperature screening of all visitors to the court, and anyone who refuses to be screened should not be allowed inside the court premises. In Abuja, Vera Chumuba, NTA News.
And humanitarian services have continued to touch hundreds of lives across different internally displaced camps in Abuja. Abubakar Usman Akwanga reports that the social intervention is coming as the lockdown directive enters day 9.
An extraordinary moment for ordinary people living in an IDP camp with the emergence of the coronavirus infection is really a double tragedy. So any offer at this moment is a lifeline. It is indeed a moment to test the goodwill of a caring neighbor, and the mountains of fire and miracle ministries has proven such in a positive way, making the IDPs to forget the mood of the war.
Today, everybody will cook food in his house by the grace of God.
The people are excited. At least this will go a long way to alleviate the hunger.
The story was different in one of the camps as IDPs were enlightened on ways to avoid the spread of COVID-19.
Awa Aliyu, like every other child here, I just undergone the ritual of hand washing, a practice that is universally adopted.
Awa Aliyu goes to get a lunch after purifying her hands like other peers of ours and walked home with smiles on their faces from a charitable intervention. Food may just be an antidote to overcome hunger, while more than 2,000 population across camps need more than a square meal to survive the global pandemic.
We're here to feed the kids. This support of food items here at the Kaura Internally Displaced Persons Camp in the FCT is to assuage the suffering of victims of social unrest and to encourage them to stay indoor during the 2 weeks presidential directive for total lockdown of the FCT and of course other cities across the country. In Abuja, Abubakar Usman Akwanga, NTA News.
Okay, like we told you earlier, we were expecting a medical virologist to talk to us on recoveries from coronavirus across the states. But before then, though we have him here, he is Professor Abdulsalami Nasidi. Thank you for joining us, sir.
Thank you very much.
Now, but before we continue on the discussion, we'll have to discuss with the governor of Ekiti State via Skype to talk more on the coronavirus pandemic. The Executive Governor, Ekiti State, Kayode Fayemi. Thank you, Your Excellency, for joining us on Nationwide today.
Thank you for having me.
Okay, now, at the moment, there are 2 confirmed cases in Ekiti State. What measures have been put in place in preventing the spread of COVID-19?
Well, I think it's important for me to correct that. Yes, there was an index case that has since been negative and has been released. And the second case that we have now has tested negative once, and a second test is now being conducted at the Institute at Ede in Osun State. We are awaiting the report, but the patient is generally okay. His temperature is within the expected limit. On our part as a state, we started early in this journey. We set up a task force way back in March 2nd, I believe, and the enlightenment campaign in Ekiti has been very comprehensive. We went on from that to declare a stay-at-home order, and then we have had that for 1 week now. This is the second week. We took some steps because of the Easter holiday that is on its way to relax that today, on Thursday, and on Sunday for the Easter Sunday ceremony. But we have maintained the curfew. The dusk to dawn curfew in the state is maintained. Our operation and isolation center has been functioning well. We have had to procure protection equipment. We've had to train our doctors. We're in regular communication with the Center for Disease Control. And the Governors Forum collectively have been very, very active on this matter, working in partnership with the Presidential Task Force on COVID-19. So, and only a few days ago, I set up a statewide committee comprising of some of the most distinguished Ekiti citizens, including 3 former governors in our state and several of our professionals, to help drive the citizens' mobilization and resource mobilization effort around this COVID-19 challenge. So it's been a pretty intense period, and I also just came out of isolation myself. I have had first to go and undertake a test because I had encounters with some patients who have been positive, but thankfully I'm negative and I'm out of isolation.
Okay, Your Excellency, would want to know what palliatives are in place to, to cushion the effect of COVID-19, particularly on the vulnerable in the states.
Well, as you may be aware, in Ekiti State, we've always been very strong on protection for the vulnerable segments of our population. We've always had a social security benefit scheme for the elderly who are indigent and don't have anyone to look after them. And we've run a food bank since my first term in office. But this time around, we've expanded that to include the vulnerable poor, not just the vulnerable elderly, and also those who have suffered loss of income as a result of the lockdown that has been occasioned by COVID-19. Only yesterday, I flagged off the food bank, which is providing palliatives for the vulnerable poor in our state and the vulnerable elderly in our state. And that's the first phase of that outbreak, we will continue for as long as we have to deal with this pandemic.
Thank you very much, Executive Governor of Ekiti State, Kayode Fayemi, for your time. Thank you very much, sir. And of course, with me still in the studio is a medical virologist. He is Professor Abdulsalami Nasidi, and we'll be talking about recoveries from coronavirus across the country. Now, we seem to have some cheering news. We have 35 recoveries and more on the way to recovery. So we can really say that the COVID-19 is not a death sentence if one contracts the virus.
Definitely so. We have good news, and we should be sharing this good news that, in Nigeria at least, we are having very high level of recovery, and but that is not a sign for us to start jubilating and thinking that the virus cannot spill surprises. This high rate of recovery could be either due to the fact that our medical teams are doing very well, which definitely they are, and but it could also either be to the fact that most of the people affected so far are younger, population as compared to Europe, where most of the people dying are on the average, about 75 to 80. But the age group of those affected in Nigeria is still within that 30, 40, 50. So survival rate in those groups will definitely be higher. But it could also be, we shouldn't ignore the fact that maybe there are things that are happening in the country or in the African continent that is making the virus to be a little bit less potent. In fact, not jokes or jokes apart, it could be some of the things we're eating. If you remember the first index case, the Italian said he was enjoying amala, and he was eating amala and our soup and all this. So we shouldn't ignore the fact that those two could contribute. Even the governor of Oyo State said he was eating amala 3 times a day, and the black seeds. So these are the things we should take into consideration, that there are some factors that are making the virus not to be very potent in Nigeria and some African countries. But if we think that the virus is not capable of doing what it's doing in Europe, we shall be making mistakes. Okay. For instance, in Nigeria, we started having cases before Niger Republic. We started having deaths before Niger Republic. You can't believe today Niger Republic have 10 deaths already. And so some countries in Africa that thought, it is like a common flu, are now warming up to really wake up. That we hope when you have community transmission and more cases are coming, so we might be having more deaths. But we pray it doesn't happen. Okay, now it is a well-known fact that the virus has no cure, as they say, but we have seen recoveries here in Nigeria. Are we likely to see more of these recoveries? Definitely. That's what I'm saying, that if the virus is affecting mostly young generation, it's affecting, now people that are a little bit, not within that range that you have high mortality, we might be having, less mortality. If we maintain the type of medical response we're doing in the country, and maybe even strengthen it, improve it, as we are already encouraging everywhere in Abuja, in Lagos, in all other states. You can see the state governor is on top of it. So when the chief executives are on top, they are supporting the team, they are encouraging the team, they are giving them the protective equipments to protect the healthcare workers, and all this. They will work 24 hours, and our survival rate will be higher. Okay, now there's this concern that Abuja is witnessing less recoveries. Now, would you say that the treatment is different from what is being done in Lagos and other places? I think it's a mistake. Abuja is not witnessing less recovery. Abuja is, a little bit more cautious, but very soon the Minister of FCT will pronounce, and many good things are happening in Abuja already. Okay, yes. Thank you very much, Professor Abdulsalami Nasidi, medical virologist. Thank you for your time. My pleasure. Thank you. We now join Suleiman Abdullahi Rigachuku in Kaduna for more on Nationwide.
And welcome. 8 states of the Federation are expected to benefit from a palliative intervention against COVID-19 pandemic worth 100 million naira. Hazalor Shetima reports that the intervention aims at alleviating the impact of the pandemic on the daily lives of the beneficiaries.
The fund is to be dedicated towards the procurement of assorted food items and medical equipment, which will be distributed to the most vulnerable and less privileged in the society. Ali Muhammad and Nafisa Usman are among the beneficiaries from Kaduna, which is one of the benefiting states. They describe the intervention as a move with human face.
Because of this virus, we are not moving out, and now that I have this, I'm very happy.
The benefiting states include Kaduna, Sokoto, Borno, Gombe, Kebbi, Zamfara, Bauchi, and Jigawa.
This is a very critical situation the people are in this world, so it's donate this kind of food and item, hospital item, equipment, also help them how they can go through this situation.
Whatever we're doing as government, we always appreciate those people that always support government effort. So for this gesture, honestly speaking, on behalf of His Excellency Maulana Rufai and the good people of Kaduna State, we want to thank the Muslim World League for bringing this palliative to our people in Kaduna State.
Muslim World League advises the people to adhere to public health warnings against COVID-19. In Kaduna, I am Hassan Lawan Shattima, NTA News.
In spite of the fact that people at the rural areas are aware of the outbreak of COVID-19, there is still much to be done to sensitize them on the measures to be taken to contain the spread of the pandemic. This is because the people at the grassroots continue to perform their normal activities without taking any precautionary measure against the disease. Awal Haliru reports.
Certain percentage of Katsina State population are rural dwellers, and their style of living makes them vulnerable to coronavirus pandemic.
The best thing is the issue of prevention, and that is why, in our opinion, no strategy, no preventive mechanism is too big or too small. The committee is only using the opportunity to appeal to people to understand why this strategy came about.
Kwarantama village is 20 minutes drive from the state capital and is located in Jibe local government area of the state, where the residents claimed awareness about COVID-19 but not reflecting on their activities.
We wash our hands regularly as requirements for personal hygiene to protect ourselves against the coronavirus.
We have gotten information about coronavirus through the media, and we are using all the safety guidelines.
Although there were strict adherence to the safety guidelines, such as restriction of social gathering, effort must be intensified to sensitize people at the rural areas to enable them learn more on the protective measures against the deadly coronavirus pandemic. Awal Haliru, NTA News.
And with that report, Nationwide continues with Ifoma in Abuja.
Thank you, Suleiman. And the Federal Ministry of Humanitarian Affairs and Disaster Management says only the vulnerable group will benefit from the 70,000 metric tons of food items released by the federal government. The minister, Sadia Umar Farouk, clarifies this as her ministry takes delivery of the food items from the Federal Ministry of Agriculture and Rural Development in Mina, Niger State. Musa Baba Aliyu reports. Okay, I'm afraid that story is not ready. We'll bring it to you in the course of the bulletin or subsequent bulletins. Now, the FCT Minister of State, Ramatu Tijani Aliyu, has disclosed that the administration will this week commence the distribution of palliative materials to the less privileged as part of measures to cushion the effects of the sit-at-home presidential order. The minister made this disclosure during an inspection tour of storage facilities at Kubwa NYSC orientation camp in Abuja. Ifeanyi Ezumba has the details.
Emphasizing that the palliatives are targeted at the vulnerable residents and the physically challenged in the rural communities. FCT Minister of State Ramatu Tijani Aliyu revealed that security measures have been put in place to safeguard the palliative materials.
We have identified capable hands that will do that for us across the structure. So we must be able to at least see how the area council on Monday will be meeting with them to also educate them further. We have seen how chaotic, how difficult it could be. So how will it affect the house to door-to-door exercise?
The FCT administration has identified 5 large stores and 5 hostels at the Kubwa NYSC orientation camp to serve as storage facility and isolation centers respectively. About 5 trucks of palliative materials are expected to arrive soon at the camp. In Abuja, Ifeanyi Ezumba, NTA News.
And for more reports on the federal government's conditional cash transfer, let's join Felicia from our Jos studio. On the federal government's conditional cash transfer,
Thank you, Ifeoma. Welcome to Jos. Governor Simon Lalong has directed a total lockdown of the state effective 12 midnight of Thursday 9th to 11 p.m. of Wednesday 15th of this month. This is to enable the state carry out fumigation exercise, which will cover Jos, Bukuru Metropolis and all the 17 local government areas of the state. The governor disclosed this at a media briefing on the progress on the fight against COVID-19 pandemic. Priscilla Grumnan reports.
Governor Lalong, who is chairman of the state COVID-19 task force, outlined practical steps taken so far by government in the fight against the pandemic, said nothing will be left to chance to ensure the disease does not find its way to the state. On the total lockdown, the governor explained that since the state has not recorded any case of the disease, it has become expedient for government to be more proactive in blocking it from sneaking into the state.
I am directing a total lockdown effective 12 midnight of Thursday, the 9th of April 2020 to 11th of Wednesday, 15th April 2020. During this period, there will be no movement of any kind except for staff on essential duty.
In line with federal government's directive, the governor added that the state has proposed to establish a 300-bed treatment center to be located at the Riom General Hospital and the state NYSC camp in Mangu.
We are also taking steps to establish more COVID-19 isolation centers in Bangshin and Shundam to cover the other senatorial districts in the state.
The governor appreciated corporate organizations and individuals that have contributed to the Plateau State COVID-19 Support Fund through cash donations and items, noting that the state is liaising with the federal government with a view to getting some palliatives to the state, and called on citizens to cooperate with the government in dealing with the pandemic. In Jos, Priscilla Grumnan, NTA News.
Plateau State has commenced the disbursement of conditional cash transfer in line with federal government directive that beneficiaries be given their allowances as part of palliative measures amidst COVID-19 pandemic. The first phase of the exercise captures 26,000 people. Ekemeren Kaneng Ladoja monitored the exercise in Zabolo community of Basa local government area.
The conditional cash transfer is part of the social investment program of the federal government, which involves disbursing 5,000 naira to people considered the poorest of the poor in communities. The program in the Plateau State initially covered 6 local government areas, but now captures the 17 local government areas of the state. The beneficiaries are also given livelihood enhancement training to ensure self-reliance in future.
So today, in some of the cluster groups, in 6 local governments, we have a savings of over 25 million naira from the little contribution these groups are making. So this tells us that in no distant time, their economic status will definitely change.
These people ideally are supposed to stay at home, but for them to stay at home, they need some palliatives, and that is why they are here to access this cash, which had been ongoing before now. But as they try to assess that, we try to maintain social distancing, we try to educate and inform them about the pandemic.
For Ya'u Adama, a visually impaired housewife, and Yakubu Atta, a visually impaired farmer, the payment of the allowances is an answered prayer. This exercise is being replicated in the 17 local government areas of the state. In Jos, Ekemeren Kaneng Ladoja, NTA News.
For more reports on Nationwide, let's rejoin Ifeoma in Abuja.
Thank you, Felicia. And as we earlier told you, that the Federal Ministry of Humanitarian Affairs and Disaster Management says only the vulnerable group will benefit from the 70,000 metric tons of food items released by the federal government. Let's get the details with Musa Baba Aliyu.
The food items released to the Ministry of Humanitarian Affairs, Disaster Management and Social Development by the Federal Ministry of Agriculture consist of 35,000 metric tons of maize, sorghum 25,000, millet 5,000 and cassava flakes known as gari 5,000 metric tons. They are meant for distribution to Lagos, Ogun and the FCT as a palliative measures to cushion the effects of COVID-19 lockdown directives in the three areas. The warehouse here located in Minna, Niger State capital, is housing more than 25,000 metric tons of assorted food, including gari, maize and sorghum. Out of the figure, 12,500 metric tons will be handed over to Ministry of Humanitarian, Disaster Management and Social Development for on distribution.
We have 10,000 of maize and 2,500 of gari. And these are going to, part of it will be going to at least the three frontline states, Lagos, Ogun and FCT.
Minister of Agriculture, Mohamed Sabana Nono, and that of Humanitarian Affairs, Disaster Management and Social Development, Sadia Umar Farouk, streamlined how the food items would be lifted and distributed to beneficiaries. They agreed that Minna Center should serve Lagos, while that of Lafia would be moved to Abuja, and Ogun State will get its own delivery from other centers.
Minna being a fairly centralized place, from here we intend to move gari into Lagos and Ogun State. Maize, NEMA will determine when it is going to be moved.
NEMA is in charge of the logistics to distribute these items to the populations that are affected by the lockdown. 25% of the population of the state, those are the ones that we are going to reach out to. And these are mostly the vulnerable in the states.
The director in charge of strategic food reserves says all the food items are being transported concurrently from all the centers. From Minna, Niger State, Musa Baba Aliyu, NTA News.
Jenny is standing by in Port Harcourt for more stories on Nationwide.
Very much, Ifoma. Good evening and welcome. About 9,600 poor and vulnerable Nigerians in Rivers State are smiling home with the commencement of payment of 20,000 naira conditional cash transfer. This measure by the federal government is to help families cope with the financial burden occasioned by the coronavirus pandemic. Kingsley and Marjorie reports.
The conditional cash transfer under the National Social Investment Program targets the poor and the vulnerable group in the country. The program, which started in September 2019 in Rivers State, is targeted at 6 local government areas of Akokotoro, Degema, Okrika, Ogubolo, Kana, and Tai local government areas, based on World Bank Poverty Ranking benchmark.
We're asked to start just 30% of the number of LGAs in the state. So based on that, 6 local governments were approved.
Selection of beneficiaries was through community engagement, with 1,731 households receiving payments for January to April 2020 in Okrika local government area.
The total number of people benefiting in Rivers State now is 9,587 beneficiaries across the 6 local governments.
To some of the beneficiaries, the directive by President Muhammad Buhari for immediate payment of the fund to the poor and vulnerable households at this trying time is indeed commendable.
It goes a long way. I will buy some food stuff, save small at least in my own account.
My dear, this money I get, I go take a gari shop.
For him and others who have benefited from this program, they are indeed delighted as this money is coming handy at a time the nation is passing through a trying period. From Okochiri in Okrika local government area, I'm Kingsley Amajiri, NTA News.
Thank you, Kingsley. And Rivers State government is set has set aside 2 billion naira to buy of all agricultural products produced by farmers and fishermen in the state to ensure sufficient food supply. The governor made this known while briefing journalists at Government House, Port Harcourt. Ogedi Nyekwere reports.
Coronavirus pandemic has become a topical issue for governments across the globe. The number of deaths recorded daily calls for concerted efforts. Thus, the Rivers State government, as part of measures to contain the virus, has set aside 2 billion naira to purchase all agricultural products produced by farmers and fishermen in the state. To achieve this, the state government will set up a 32-man committee to be chaired by the secretary to the state government. The commissioner for agriculture will serve as the secretary.
Our goal is to ensure that no agricultural products like yam, garri, plantain, palm oil, and fish leave our state during this period. While the farmers and fishermen will make their profits, the less privileged will have enough food supply for their families.
Governor Wike also commended the diligence exhibited by the health professionals and security agencies. While appreciating the media practitioners, he urged them to use their various platforms to educate and enlighten the populace to ensure the virus is contained. In Port Harcourt, Ogedi Nyekwere, NTA News.
That's it from Port Harcourt. Now, the Niger State government has commenced disbursement to beneficiaries cash payments for the household uplifting program of the social investment program of the federal government. Dawda Mohammed reports that 19,725 vulnerable persons are expected to receive cash payments worth 400 million naira.
The Household Uplifting Program, also known as the Conditional Cash Transfer Program of the federal government, aims to address deficiencies in capacity and lack of investment in human capital of poor and vulnerable households. Augusta John is among the 103 vulnerable receiving cash payments ranging from 5,000 naira to 20,000 naira, depending on the accumulated backlog in the Kuyambana Primary School pay point.
But he has been really assisting me, bringing up the children.
I am happy with this assistance because I am sick and a widow with 8 children, and this will help.
Niger State Governor, represented by the Secretary to the State Government, Ahmed Ibrahim Matani, assured officials of the program that all efforts will be made to ensure the success of the program in the state.
That we have put together 4 months so that under this condition of coronavirus pandemic, there is need for those most vulnerable to be supported.
We are working as a team. Some of the staff will be going to Agwarat, some will be dispersed to Shiroro and all the various local governments.
Beneficiaries are drawn from the 25 local government areas of the state, mostly the elderly women and men in Mina. Dawda Mohammed, NTA News.
And now sports. Pelican Queens appeal for unpaid wages as Amanzi Marcos reports on Sports Updates.
The Cross River State Commissioner for Sports, Ofa Aya, has promised to look into the allegations of the state women's football team, Pelican Queens, over non-payment of their salaries since June 2019. The sports administrator who addressed the players during a protest at Cross River State Government House, Calabar, said he is not aware of the problem, having assumed office in late 2019. As the coronavirus pandemic worsens around the world, the Brazilian Football Confederation is planning a $3.6 million lifeline for 140 clubs in the lower divisions. Beneficiaries include 88 clubs in the third and fourth tiers of the men's leagues and the 52 teams in the top 2 women's divisions. CBF President Huseru Kaboklo said, "We are living through an unprecedented moment of global crisis whose extension and consequences are still incalculable. Hence the decision to provide direct and immediate help." But coronavirus earlier forced a postponement of the state leagues. Meanwhile, the long-standing investigations into corruption in football that has swept many away from their positions has reopened in Brooklyn. 2 former Fox executives, Hernan Lopez and Carlos Martinez, stand accused by U.S. prosecutors of paying millions of dollars in bribes to secure lucrative media and marketing rights to football matches. Lawyers to the accused describe the charges as a teen case and state fiction.
And that concludes Nationwide for today. We thank you for watching. Please remember to stay safe.